welcome to Let's Talk, our weekly Optimal Health Community webinar. My name is Jan Paxman, and I'm a registered nurse, and also I have been a certified Optavia coach for the past 15 years. I love my nursing career, but I love coaching more because it's allowed me to center my life around the things that matter the most to me, like really serving people to create optimal health in their lives. And I get to be more present. I'm a mama to 8 and a granny Janny to 13, and I'm so excited to be hosting tonight. And before I introduce my two amazing co-hosts, I just want to give a special shout out to the incredible guy behind the scenes, Chris Pettit. He's our tech wizard, and he keeps everything running smoothly, provides comic relief, and just brings the best energy. We always appreciate you so much, Chris. So for those who may be wondering, I've got two amazing co-hosts with me tonight, and they are going to be introduced really quickly. And for those of you who have been on our WinZooms, how many of you guys know what a WinZoom is? If you're a WinZoom regular, put a high five in the chat. So for those of you who are wondering, what is a WinZoom? Wins are short, powerful Zooms designed to help you apply Dr. Anderson's Habits of Health system, the Life book and the Habits of Health book. These two books help you create lasting change in your mindset and behavior. And WinZooms are held 10 times during the week so that you have an opportunity for 15 minutes to get your mindset right. And these two ladies tonight are regulars on those WinZooms, and you get to hear from them often. So it's powerful. So I would love to bring up Megan Engbring and Julie Hittleman. And I'm going to take a moment here to introduce them properly. So with Miss Megan here, you can see her awesome photos. Oh my goodness. She is totally rocking her health. She has over 23 years of experience in nursing, 14 as a doctor of nursing practice and family nurse practitioner. And Megan brings so much expertise in patient and outpatient care. She's originally from Minnesota, but she's now in Flagstaff, Arizona. And she has found her passion in lifestyle medicine, supporting patients in sustainable medical weight management. And she's a certified Optavia coach also for 5 years. And you can see what she does with her family. They are hiking, skiing, doing all the things. She has a darling 10-year-old daughter and her handsome husband, and we're just so happy to have you here tonight, Megan. So welcome.
Thank you so much. I'm happy to be here.
Yeah, and Julie is a Daisy Award-winning nurse with 23 years of experience in the medical, surgical, urgent care, hospice, and specialties like endocrinology and gastroenterology. Her passion for helping others shines. You guys, you all know it. She lost 120 pounds while she was working in crazy hours during the COVID pandemic. She just lights the way for others. She has so many pearls of wisdom that she loves to share. She has a husband, Scott, that's super supportive. She's a proud mom of two thriving adults. And when she's not coaching, she loves paddleboarding, yoga, hiking, and she serves her community in so many ways. She's just transformed her life. And I love this picture that Chris put together of her riding the dog from the Never Ending Story. And if you guys want some extra credit points, put the name of that dog in the chat. I know what it is, but I want to see if you do, if you ever watched the Never Ending Story as part of our, past life. Anyway, so we want to get started quickly. It's only 5 after. I love it. We got a lot of time. So we are going to do a Q&A tonight. And this is so cool because we're not only streaming live, but we're also going to be podcast and people will be listening over podcast. There's so much good information you're going to get tonight. So we're going to start with a couple of questions. This is live Q&A that we get a lot. And so Megan, I'm going to throw the first one over to you. As someone begins using our programs and balancing out their nutrition and just all the protein, carbs, fats, the fiber, all the things, sometimes they may experience a few changes in their gastrointestinal tract. So there might be some diarrhea, some constipation. We can talk about that, guys, right? It's real and raw tonight. I was wondering if you could address why this could happen and offer some ideas around how to navigate it. Over to you, Megan.
Yeah, absolutely. What a great one to start with, because I think that this is a really common question. And, as a basic answer, anytime that we make any kind of a fairly drastic change to our nutrition plan, we may see some changes in our digestive tract, whether it's things are a little bit slower, things are a little bit faster, looser, harder. As nurses, we are really comfortable talking about this stuff, but I know that other people aren't always. So if you have any questions along this line, just please know that it's totally normal and natural for your digestive system to take some time to adjust. Most people, whether you're starting our 5-in-1 plan or 4-in-2-in-1 or optimal health 3-in-3, oftentimes there's much more fiber than people are used to having in their diet. And fiber can actually work either way in the digestive system. So that's important to know. And then in our fuelings, there's also a patented probiotic in each fueling. And probiotics are so good for our gut health, but sometimes we're just not quite used to them, or as they're balancing things out in our gut, we can start to see some changes there. Sometimes we need a little bit of like a detox or a little bit of a cleanse happens while we're detoxing or getting into a fat burn. And then another big difference that we see is often the frequency in which we're eating on plan. Not too many people are coming in actually eating 2 or 3 or every 2 or 3 hours. And just remember that that's, constantly adding a little bit into our digestive system. So it's changing the way that our gut works. But really normal to have some constipation or diarrhea just getting started on plan. It usually starts to normalize after a few weeks, sometimes as long as a few months. Rarely we might find a particular ingredient or something that just doesn't cooperate with your gut. But the health benefits that we see are well worth trying to stick out a little bit of some uncomfortable digestive issues. With the constipation, I often remind people that this is a really clean and it's like precise eating. So there's not a whole lot of waste. Our body is using almost everything that we put in. So sometimes constipation is just a little bit less volume, less waste. We're really putting that to use. So what can we do? Stay consistent on plan unless you feel like something is really, really off with your gut. Then of course you should consult your personal health provider, your primary care provider. But staying consistent, if there's a certain trigger that you notice, you can avoid that. Or if there's a certain type of fueling, maybe just have one a day if that seems to trigger something one way or another. You can certainly use some over-the-counter remedies like a low sugar fiber supplement, Imodium AD. You can use some Colace if you're feeling a little constipated. And remember to just stay really well hydrated, get that movement in. Healthy movement is also great for the gut. And then just one little pro tip about the over-the-counter ideas is try to avoid things that would have extra carbs and kind of throw you off plan, like some of the gummy fibers or a higher sugar Metamucil, things like that can actually kind of hinder. But super common to have a little GI change just getting started on plan.
Awesome. Awesome. Thank you, Megan. That's so good. Another thing that I have found that helps with if you're constipated is there's Smooth Move tea. It's like a
Oh
natural
yeah, I love that.
in the grocery store, and that seems to do the trick.
That is a great
And yeah, I have used that with my clients and myself, and it works really well. So that's awesome. Somebody's asking about flaxseed tablets. Do you guys know anything about flaxseed? David.
But flaxseed is a great fiber. It's got some great omegas in it. That could be super helpful. Yeah, is again, just kind of look at that carb content. But I love all the natural remedies. If we can avoid some of those over-the-counter things, it's always best to stay natural. I've heard Dr. A call that over-the-counter section in Walgreens amateur hour, which really stuck with me because it's like before you actually move to the pharmacy where you're loading up on Tylenol and all that stuff.
Yeah, love it. It's Smooth Move tea. Smooth Move, Ellen. Yeah, and
Mhm.
Alex is saying water, water, water. That is so true. Make sure your
Um,
water is up. And another thing too, that sometimes helps is, you've got those extra snack options that you can use. They're like on page 17 of your guidebook. And sometimes just throwing in there the 3 stalks of celery plus upping your water a little bit, getting a walk around the block, that can help as well. So love all those tips, Megan. Thank you so much. Okay, let's switch it over to Julie. And Julie, you have shared with us today that you coach quite a few people that have diabetes type 1 and 2. And so can you share a little bit about what would be important for someone who has diabetes to focus on?
Well, thanks, Jan. This program is amazing. And what I love about our program is it works really quickly in a lot of different ways. And one of the things I've noticed specifically with, my diabetic clients is their blood sugars coming down really quickly. And so it's really super important for diabetics to be monitoring their blood sugar and making sure that as they're losing weight, some of the medications that they take might be too much for their now new weight. And it's really important to talk with their healthcare provider and say, hey, I'm losing weight and this is what I've noticed in my blood sugars. So their primary care doctor or their endocrinologist can adjust medications accordingly, because it's really important that as their blood sugars drop, that they're supporting their body properly, because too much medication can really cause the opposite effect and can be just as dangerous. Also, a lot of the insulin resistance we see in adult onset diabetes that they're getting treated for, because our program has a way of lowering their blood sugar and getting them out of that insulin resistance, is really paying attention to symptoms that they're having that aren't normal for them. That they might feel lightheaded or dizzy, or they might start to sweat a lot and start to have, hypoglycemic type reactions, to reach out to their doctor. And don't wait. I always tell my diabetic clients, that if you're suspecting something's going on and it has to do with your diabetes, it's better that you reach out to your primary care doctor or who's managing you, rather than your coach, if it's something you think is a medical issue. Because as coaches, I may have a medical background, but not every coach does. And so it's really important that they have that conversation with their doctors, and also that they let their doctors know they're starting the program to begin with, so they're aware of what could happen. And especially diabetics like type 1 or some type 2 that are on continuous glucose monitors, such as like Dexcom, where they get real-time results back with the foods they're eating, and they can really monitor it, and it gets transmitted to their doctors. So they can have, if they're on a sliding scale of insulin, that may change drastically. So being up on that so that they can adjust their insulin accordingly, so they're doing it in a safe way. So all of those things really play into the diabetes, whether you're in a type 1 situation or type 2. And with the type 1s, making sure that they are, monitoring. And most type 1s are really familiar of what their macros have to be for the type of insulin they're using and how to adjust accordingly, because many of them are on continuous glucose monitor and sometimes an insulin pump. So knowing how to really calculate their macros for their carbohydrates and how much insulin is necessary, and to really pay attention to that.
Oh, that's great, Julie. Such good information. I'm seeing so many people are saying in the chat that they've found so much value in using this program, and it's helping them to control their blood sugar. Their medications are being reduced, and they're working with their doctors. And this is so exciting. I was a diabetic educator in my nursing career as well, and I love this program to work with people who have diabetes. I don't call you diabetics because I think of you as people who have it, right? It doesn't define you, but it's something that we can learn to manage. And sometimes my clients, and well, anyway, I probably shouldn't say that because it's against compliance, so I won't, but I can say that your diabetes situation can improve greatly.
I will,
For type 2.
yeah, right. I will say I've had a number of clients that as they lose weight and use our program, they've noticed a decrease in their A1Cs dramatically over the first 3 months they're on the program. And many of them have reverted from very high A1Cs to a either pre-diabetic or normal range, just with using foods. And I've seen that over the last 5 years. So
That's a
Oh,
great
yeah,
way to
me
put it.
too. Yeah.
Good job. Good
Our
job.
program works great for balancing blood sugar. We love that. And improving cholesterol, which I think we can say those things, right, Jan? Because on our disclaimers, we can talk about lowering blood pressure, blood sugar, and cholesterol.
Cholesterol. And
Beautiful.
I will throw in there then for our menopausal clients, that are in insulin resistance, that are having that current spike in cholesterol and all of those things that happen as our hormones change. This program's great for that too. So
Yeah, so good. Love it. Thank you guys. Okay, I'm going to throw this one back over to Megan. It is about that. Please address, Dominique asks, please address also blood pressure meds and statins while on program. And that's your sphere of
Yes.
expertise, sister.
This is well within my sphere of expertise as a cardiology nurse practitioner. So, blood pressure medication often has to be reduced after some weight loss. It doesn't generally happen as quickly as, say, some diabetes medications, but just to kind of ballpark, maybe around like 15 to 30 pounds lost, I'd say, could be a good time to really start checking in on your blood pressure again. Some signs of your blood pressure being too low could be dizziness, lightheadedness, fatigue. Certainly staying well hydrated is helpful with that. But if you're having some symptoms like that and you're taking blood pressure medication, that should definitely be something to think about. What is my blood pressure? Is it getting too low now that I'm eating so healthy and reducing my weight? And then with statins, they're perfectly, healthy to continue taking on plan. There are many conditions where it's recommended to be on statins lifelong. So not everybody has a goal of actually stopping statins, but oftentimes doses can be reduced. For my patients who don't have a specific evidence-based recommendation to be on a statin, I will always give them the option of going on plan, whether they've got weight to lose or not. But I see incredible reductions in cholesterol panels across the board, specifically in triglycerides. People with high triglycerides, that's often caused more from sugars and ultra processed foods and things like alcohol and sweetened beverages, which we really try to limit or avoid on plan anyways. And then balancing that blood sugar with the small frequent meals, that's also great for triglycerides. LDL cholesterol is more from animal fats, meat, cheese, and dairy. So choosing more lean proteins and limiting those higher fat options also helps to reduce the LDL cholesterol. HDL is the good stuff. That really starts getting better, especially if you're taking some good omega-3s, like we've got the multivitamin and the fish oil packs now. Staying active helps to improve that HDL cholesterol. So I see such incredible results on cholesterol panels. Specifically, I get so excited to review cholesterol panels for people on plan because they just look phenomenal. And I won't say that because of a disclaimer thing, but it works really well, really well.
I'll want to.
well,
Awesome.
I will say that I was one of those people, and for me, that's what the plan did for me personally. I have a family history of hyperlipidemia, where I produce more cholesterol than most people, and so triglycerides was a huge thing for me on this program, and along with cholesterol, and so yeah, it does work.
Oh, even just reading the chat, I'm getting all excited here because people's A1C is improving, people talking about their own cholesterol panels improving. I love having this to offer.
Yes. Hey,
Absolutely.
let me throw out there, we've got a couple people actually asking about what about anticoagulants or blood thinners with the program? Do you see any correlation between, does it impede the program working? Does it do those
Doesn't
down as
impede the
well?
program working
Anything like
at
that?
all. There's a lot of new anticoagulants now that they're not vitamin K dependent. Warfarin or Coumadin, that's the one that's been around the longest. That is vitamin K dependent. So there's a lot of vitamin K in leafy greens and some other vegetables. You do not have to limit that, but if you're suddenly eating a lot more leafy greens, you just need to be checking your INR more frequently, and then your provider can adjust your dose to accommodate this healthy new nutrition pattern. So again, you do not have to limit vitamin K, just make sure that your healthcare provider is following that INR with you. And you do want to have a consistent vitamin K intake if you are on Coumadin or warfarin.
Great. Love that. And somebody's asking about diuretics as well, or water pills.
Sometimes they're used for hypertension, so same issue with the blood pressure medications that I already mentioned. If your blood pressure is dropping too low, you may need to reduce that dose. If your healthcare provider has told you to limit your fluid intake for any reason, specifically heart failure is a reason for that, or severe kidney disease, certainly you should follow those guidelines, but otherwise the recommended water intake is fine.
Awesome. Love that. Thank you so much. Okay, we have a couple of questions here. So let's see. Dawn is asking, she was using the 5-in-1 plan, and she is coming back to it now the second time around. And she said, why is the 5-in-1-ish the second time around so much more sensitive? The first time around, I was right on and had selective times when I went off plan. Did not remember the scale jumping, still lost. Lost 65 pounds, gained back some pounds, 18 pounds, worked on mindset and binge eating, ready to release that 18 pounds. She's back on, but she's seeing if she deviates at all this time, it's not as forgiving. Could this be my age or menopause related? So.
Wow, without knowing the particulars, what I will throw out there is we know that with 5-in-1-ish, you get ish results. The program is really based in science. And like I tell a lot of my clients who are ishing it on the weekends and really diligent during the week, is that for every gram of carb that you're eating, you're holding on to 3 grams of water weight. So depending on how much carb and how much water and that fluctuation, when they see the scale go up 3 pounds or it stayed the same, and then they might jump on the scale later and it drops 3 pounds, is, to gain those 3 pounds, you're probably eating 10,000 calories, and you probably didn't do that. So it's probably carbohydrates and water. And when you ish it, it really takes your body out of that thermogenic state. And so you're not as efficiently burning fat, because our body can either burn or store. It can't do both. So if you're really diligent the first time and you notice it, it's because you're really diligent. If you're ishing it, you got to ask yourself, why are you ishing it? And maybe talk with your coach and see if maybe the 4 and 2 is a better option for you. Because if you're ishing it this time, maybe a change up in how you're addressing it or what your why is, and really look at why are you, getting back on the program and what's driving that. Because far often the pain that we start in from being overweight really drives us to be diligent on the program. And then when the pain eases off and we're not as uncomfortable in our bodies, we're not as diligent because we're not as uncomfortable in our bodies. So it can be that that's the block. So definitely talk to your coach.
Awesome. That's such a great answer, Julie. Thank you so much. I think that helped her. She's saying yes. Thank you, Julie. Love it. Love it. Okay. So I got another one. Let's see here. This one's from Kelly, and Megan, we'll toss it back to you. I read so much about cortisol. I find it very confusing. How is that impacted or not through Optavia? Take it away, Megan.
Great question. So cortisol is the stress hormone, and it's well known to cause weight gain or make it very difficult to shed excess body fat. We kind of live in a cortisol heavy world right now. And it's important to know that, working on our stress reduction helps to lower cortisol. So another plug for those wind zooms, we practice some slow, deep breathing exercises, 10 times a week, like Jan said there, using breath work or guided meditation, or just kind of noticing when your stress level's getting high and making a conscious effort to kind of slow things down and breathe. That's really helpful for the parasympathetic system. Here's something that a lot of people don't think about with stress: sleep. This is why I love the Habits of Health system, that we're not just talking diet and exercise here. Like, we are talking stress management. We are talking making sure your body is well hydrated, getting enough sleep. When we don't get enough sleep, that's a chronic stress on the body, especially if you've got something like untreated sleep apnea or your oxygen's dropping low at night. That's a chronic stress on the body. Um, Sitting for long periods of time is a chronic stress on the body. Consuming sugar and ultra processed foods is a stress on the body. And so, truly, the whole Habits of Health system, when fully implemented, and not perfectly implemented, but when we're trying to address our life on all of these levels, all of those things together will help to reduce cortisol.
Love that. Perfect. Okay, fantastic. We're getting kind of close to the end here, guys. So I'm just gonna throw out this last one. Let's see, Lisa. This is something everybody asks, that she has increased flatulence. How can I reduce as much gas as she has going on? And we've all been there. So I will start, and then I'll throw it out to you guys really quick. So first of all, we are eating differently. Sometimes it could be caused from the vegetables, but also it could be caused because we use some soy protein in our food, and soy is bean, so that could be part of it. But I find that there are some natural ways to help with this. As Megan said in the beginning, sometimes it just takes some time for your body to adjust. And then also, you could get some products like Beano is a good one from your health food store that can help to reduce that. And or you could use Gas X or anything like that over the counter. But I've also found digestive enzymes really help, because your body is breaking down extra fiber and protein and all the foods that we're eating, and absorbing those nutrients. And sometimes it can cause some gassiness. And digestive enzymes are different than probiotics. They're just enzymes that break down the food and help it to be absorbed. So if you wanted to add a digestive enzyme, that has helped my clients a lot with that. So you guys have anything else you want to add?
No, I think you hit it all. I mean, those are like my go-tos, because, everybody's body is different. So, that was something for me, that very much so everything you just mentioned was everything that I tried. And a lot of it was just my digestive system, really kind of moving, and it kind of subsided, and it was something that went away. Some people are just different, but I think those are all great suggestions.
Yeah, and forgive me if you said this, because I was looking at the great comments in the chat too, but some of the like cruciferous veggies, they tend to be a little bit more gas promoting, like broccoli and cauliflower and stuff. So maybe just choose some of the other veggies if you're feeling extra um, flatulent.
Love that. Thank you, guys. Yeah, you can go to your local health food store and just tell them what you're experiencing and ask where, the digestive enzymes, they're not expensive, and they can give you a really good brand. Like, there's lots of good ones out there. So, okay, well, you guys, thank you so much, Megan. Thank you so much, Julie. This has been so fun. And always the time goes by fast. Thanks, everybody, for your questions. We appreciate it. And we'll try to gather the ones that we didn't catch this time, and we'll do that next time on Health Pros Live. But I just wanted to take a second and remind everyone, tomorrow is July 1st. So we're in the week of the 4th of July. Did you notice that we're all wearing red, white, and blue here? I forgot to mention that at the beginning, but we planned it. Anyway, we want to wish everyone a happy celebration for freedom in this country. And isn't that what we do with our health? We're creating freedom with our health. And Dr. A is the person who set us on that path. And he speaks to us every month, the first Tuesday of the month. And it's at noon Eastern time. And there's the information there for you. If you can't get a hold of it here, you take a snapshot or something, or you could check in your client success pages on Facebook or with your coach, and they'll get you hooked up. So be sure you don't miss it, because it is fantastic. And then be sure, you guys, if you're not already subscribed to our podcast channel, just go in and find Optimal Health Community, subscribe in. It's awesome. You can if you're a coach, invite your clients to subscribe. always so powerful to have these in your back pocket. You can listen at any time while you're traveling, while you're, doing laundry, whatever you do, just pop in one of these, and it helps you to restructure your thinking, which helps you to restructure your emotion, which helps you to change your actual actions, which leads to the very best results. So anytime you can feed your mind, the better. So take advantage of that. And next week, we're going to be talking about declaring health independence. It is going to be so good. So next week on the 7th of July, don't miss it. And again, I just want to thank Megan and Julie. You guys were the best. Thanks so much for being here tonight.
Thank you, Jan. Thanks for inviting us.
You bet.
Thanks
And
everyone for the great comments. This was such a fun session. Thank you all.
yes, for sure. Thank you guys, and have a great night. We'll see you next time on Let's Talk.